hate your filler results? Here's exactly what you do from someone who's corrected hundreds of prior treatments. Let me tell you something that might surprise you. Even the best, most experienced injectors occasionally have patients who aren't completely happy with their results. Though rare, we all experience complications from time to time. That being said, one of the biggest differences that really matters at the end of the day is knowing how to handle these situations properly. As someone who's helped countless patients correct prior work and achieve the results they want, I can tell you that most filler issues can be corrected when handled appropriately. In this video, I'm going to walk you through exactly what to do if you're unhappy with your filler results. I'll share what's normal versus what needs immediate attention, the options available for correction, and most importantly, the steps to take to minimize the chance of these issues happening in the first place. But before we dive in, let me introduce myself. I'm a board-certified PA and medical aesthetics provider who specializes in natural-looking results and complex corrections. I believe in taking a conservative approach because it's always better to add more filler when needed than to have to dissolve and start over. The first thing you need to know is that timing is crucial when it comes to addressing filler concerns. For the first 3 to 4 weeks after your filler treatment, I actually don't touch the filler at all. Here's why. Your results will continue to adjust and settle during this 3 to 4 week period. Let's break down what's normal in those first few weeks. For the first 48 hours, that peak swelling will resolve. First 2 weeks, any bruising typically disappears. 3 to 4 weeks out, your filler fully integrates into the tissue, and by week 4, your final results become visible. Many concerns that seem significant immediately after treatment often resolve naturally within this first month. That's why I always advise my patients to take progress photos daily if they have concerns. It's amazing how much can change during that settling period, that first 3 to 4 weeks. However, there are some certain situations that do require immediate attention. These would include vascular adverse events, severe allergic reactions, and infection. First, for vascular events, these include vascular occlusion. They can either be arterial, when there is filler injected inadvertently into the lumen of an artery, restricting oxygen supply to the affected tissue. Or they can be venous, which causes reduced venous drainage, which eventually leads to congestion and swelling in the treated area. And then you can have embolization occur, which is when filler is injected into an artery and travels to another area, blocking blood flow in that area. And then you can have a compression occlusion. In contrast to the intravascular occlusion, where filler is injected directly into a blood vessel, a compression occlusion occurs when external pressure causes restriction of a blood vessel from the outside, which similarly decreases blood flow and oxygen supply to the affected tissues. This can be caused from either filler itself, or secondary hematoma formation, or excessive swelling surrounding the vessel. There are some tight anatomical areas of the face that have limited tissue flexibility that make these areas higher risk for compression occlusions. These areas include the tear troughs under the eye, your nasolabial folds or piriform right by the nose, your temples, nose, lips, and chin. This underscores the importance of conservative, gradually staged filler treatments and why excessive filler amounts in these areas should be avoided. Here are the warning signs you should never ignore after receiving filler. Signs of vascular adverse event include blanching with subsequent whitish gray tissue appearance, significant pain at the time of injection or pain increasing over time, a reticulated web-like appearance on the skin, concerning or worsening asymmetry not improving with time, worsening discoloration also not improving with time. A vascular adverse event is a rare complication, but it requires immediate treatment to restore blood flow to those tissues. Number 2, signs of allergic reaction include itching, hives, rash, or flushing of the skin, swelling of the face, throat, or tongue, difficulty breathing or wheezing, and a rapid heart rate and even some dizziness. And number 3 is infection. You need to know the signs of infection. These can be seen at the earliest 3 to 4 days after treatment, or in some cases it can be up to weeks post-treatment. These signs include increased redness, increased pain, warmth to the touch, tender swelling, drainage, fever, or signs of systemic infection. Different types of filler require different correction approaches. Here's what you need to know. Hyaluronic acid fillers like Juvederm and Restylane, these can be dissolved with hyaluronidase or Hylenex. This is an enzyme that breaks down hyaluronic acid, and this offers immediate correction options for your HA fillers. For a lot of injectors, HA fillers are their most commonly used filler for this reason. Then you have your biostimulatory fillers like Radiesse and Sculptra. These cannot be enzymatically dissolved like HA fillers can. These may take up to 2 years to metabolize, so these are longer lasting, and they do require more patience for correction. Now, regarding the correction process itself, if you're unhappy with your results, here's the step-by-step process to follow. 1, you want to identify your concern. What specifically about your results are you displeased with? Use descriptive language. Do you feel it is overfilled? Is it too big, or is there too much product? Or do you feel it is underfilled and you're underwhelmed with your results? Do you feel like something is asymmetrical? It's important to effectively communicate your concerns, trying to avoid being overly emotional or assuming the worst and placing blame on your injector. Number 2, you want to contact your original provider. Schedule an in-person assessment. Bring progress photos if you have them, and again, effectively communicate your concerns or displeasure to your provider. It's important to note here that unless they have given you some reason to not trust their skill, expertise, or integrity, going to your original treating provider first is important. Why? Number 1, they likely know your face and exactly what treatments they did on you. Other providers likely won't have this information. Number 2, you trusted them enough to do your initial treatment. Even if you elect not to let them do any corrective measures, it is important for the treating provider to have this feedback and be able to assess their work. And number 3, and arguably most importantly, competition can cloud objectivity in the aesthetics industry. While this is not the case for all, unfortunately, a competitive mindset is a motivating factor for many injectors, even injectors I have worked with personally in the past. So I think it's important to note this here. By and large, I do know many professional injectors who share the same values of honesty, integrity, and excellence in their practice and prioritize patient-centered care. But unfortunately, not everyone in our industry shares these same patient-centered values and strive to be focused on healing, enhancing, and improving the lives of others. Always be wary of feedback and advice given by an injector who doesn't have good professional relationships with other aesthetic injectors in their local area. When a provider's focus shifts from patient care to winning over clients or outshining other professionals, it can create a culture of distrust and misinformation. I have seen this happen, and unfortunately, at the end of the day, it's always at the expense of you, the patient. Ultimately, our patient's well-being should always be our primary concern, and an injector's ability to work harmoniously with their local peers can be a good indicator of their integrity and commitment to ethical, patient-centered practice. When choosing a provider, it's essential to stay informed and critical of where the advice is coming from, and keep this in mind when obtaining a second opinion about your filler. Number 3, questions to ask at your follow-up, and these are important. Is what I'm seeing the final result? What specific options do we have? What are the risks of correction if we do them? Do you have experience with similar cases, and what costs might be involved? Red flags in a provider's response you should always watch out for: diminishing your concerns, refusing in-person examination, unfamiliarity with correction protocols, and pressure to get just more treatment and not address your concerns. Different issues with filler require different correction approaches. For overcorrection, you can do a targeted dissolution or partial dissolution, and my preferred method is a staged dissolution where you dissolve product over a period of time gradually. For specifically asymmetry, you can add a little bit of additional filler on the underfilled side to correct asymmetry, but dissolution can also be done if asymmetry is significant. An evaluation of underlying structural causes is important while correcting asymmetry. For migration, precise micro-droplet dissolution can be helpful, natural metabolism if it's minor, and then ultrasound-guided dissolution for deeper migration. To minimize the risk of unsatisfactory results in the future, the first step is in your provider selection. Just verify medical credentials, check for board certification and an active state license, review their before and after galleries, and discuss complication management protocols with your provider beforehand. But as we discussed before, even with experience and a quality provider, complications can occur. So during the treatment approach itself, you want to start conservatively, understand various anatomical challenges that your injector is contending with, and understand the limitations of aesthetic injectables. If you are seeking a significant lift or removal of excess fat or skin, then you should also be seeing a plastic surgeon, as this is the best course of treatment for someone with these goals. You will never achieve surgical results with injectables. Review your provider's revision policies beforehand and set realistic expectations. Understand that aging doesn't occur overnight, and neither will correction. Keep in mind that the signs of aging take years to occur, and a quality, ethical, and safe injector will educate you on this and will help you set realistic expectations. They likewise will take a gradual, stepwise approach when creating your treatment plan, keeping your safety and your goals and your long-term well-being as their top priority when creating a plan for you. When considering filler treatment, here are some important considerations to keep in mind. Remember, as we mentioned earlier, some areas do have higher complication rates. Listen closely to your provider's aftercare and make sure to follow up per their follow-up instructions. Natural results may mean subtle changes, especially at first. This is important, especially for those with significant signs of aging or those experiencing changes in their face from significant weight loss. In the beginning, when you're just starting to seek treatments for the first time, your initial results may be subtle and may seem underwhelming at first. Remember, each treatment builds on prior results, and the best, most natural results long-term will provide natural, subtle enhancements that improve over time as you follow the design treatment plan. Also remember that aging continues to occur despite filler treatment. When it comes to maintaining realistic expectations, it's important to remember these key points about filler treatments. Results are temporary, and subtle improvements over time are often better for your facial aesthetic in the long run than dramatic, transformative changes in one visit. Multiple sessions will most likely be needed for best results. And remember that filler is just one component of comprehensive aesthetic care. Conservative approach with filler usually wins in the end. Now, it's important to acknowledge that being unhappy with your filler results can be emotionally distressing. This is especially true with bad complications like vascular occlusion, which can be scary for both the patient and the provider. Having a provider who understands this emotional impact and the ability to navigate it with empathy while maintaining professional expertise is crucial. Remember, most complications are manageable when they are recognized quickly, assessed properly, and treated appropriately, and managed by qualified, experienced medical professionals. The key is working with a provider who not only has the technical skills for correction, but also the experience to guide you through the process with confidence and with care. Remember, while it can be distressing to be unhappy with your filler results, there are almost always solutions available when you work with a qualified provider. It's important to be patient during this process and maintain open communication with your injector. Here are the most important takeaways. Number 1, don't panic in the first few weeks. Some issues resolve on their own as the filler settles. Always communicate concerns with your original treating provider first. Know the warning signs that require immediate attention, and choose providers who have experience with corrections. Want to learn more about getting the best possible filler results from the start? Check out my video on where to find the best aesthetic injectors in your city, where I break down exactly what to look for in a provider. Thanks for watching, and remember, when it comes to dermal fillers, it's always better to start conservatively and build gradually as a component of comprehensive treatment plan than to be aggressive and heavy-handed, over-relying on filler to achieve full correction quickly and end up needing to dissolve and start over. I'll see you in my next video.